thanks so much for joining us on Making Healthcare Work for You, Different Perspectives and Empowering Solutions. I'm Stephanie Fields, joined by my co-host, Dr. Apoorv Gupta, and we're talking about our interview with Dr. Katherine Twombley, who is a professor of pediatrics, chief of pediatric nephrology, medical director of the Pediatric Kidney Transplant Program, and program director of the Nephrology Fellowship at the Medical University of South Carolina. And this was yet another MUSC interview that was focused on innovation and how that really amazing culture of theirs to innovate, to resolve roadblocks and make things happen, to really change what's possible, their hashtag. And it has shown in her work. She told us about LDL I said it before, LDL apheresis treatment of nephrotic syndrome. I said this right before. But it's a really cool technology that allows these patients to have a whole different way of treating their condition without an ongoing treatment plan. It's a 9-week course that can cause them to go into remission, and then they go on and they live, a very different life than they might have if they're constantly on steroids or other medications that can cause harm also. And so it was so cool hearing her talk about how being at a place like MUSC that allows that, really just allows her to treat these patients in the ways that they need to be treated. My favorite story that she shared was about going to pharmacology, asking about one particular drug, and they said, okay, we have to get this. It's going to take us 48 hours. But they were on board. They were able to get it for emergency use. And then for future patients had to go through an approval process. But they did not just say, oh no, that can't happen. And I love that. I love that they're always putting the patients at the center and considering, what does this patient need? Not what does this bottom line need? Not what does this process dictate? It's what does this patient need? How do we get them that now? And if that works and we've realized this is a good solution for them, how do we make this possible for other people very fast? So I just loved the fact that, once again, it's another empowering story of MUSC changing what's possible and making miracles happen really for their patients every day. I love it. Apoorv, what were your takeaways?
Thank you, Stephanie. Yes, I enjoyed that very much as well. Now that you and I have done so many of these interviews with various MUSC clinicians and leaders, I think it's really apparent that this culture is deeply, deeply ingrained. And I'm not sure I can still put my finger on why and how, because it's not clear to me exactly why MUSC is able to do it, whereas other people may not be able to. But yet it's very evident that the culture is present. When Katherine talks about how the institution has gone to such great extents to take out the barriers, to make sure that people are thinking, how do we make something happen rather than not making it happen? That's happening throughout the organization. It's happening at the leadership level. It's happening at the clinician level. Clearly, otherwise, these kinds of innovations would not be getting into the hands of patients. So that's really dramatic to me. I think that when Katherine talks about the stories of being ahead of the research and constantly being aware of what's going on, and then being able to bring those ideas into the institution, it's almost electrifying, because you can understand that there's patients who are going to be helped because this culture of thinking about the patient first is truly present. So it's really remarkable. I'm so excited to hear about what Katherine and all her colleagues are doing at MUSC. I hope that we'll be able to continue to get more insights into how exactly they've built that culture. It's just truly amazing that they've been able to figure out how to create something without a lot of financial rewards, by the way, either. When we pushed her on that, she didn't mention, it's because we get paid for it. It's just because everyone there is just thinking about how to help the patient. So I'm just looking forward to continuing to learn more about how that culture has been created.
I loved that. I love that you said without the financial incentive. And of course, I'm sure MUSC, they are a wonderful institution, and I'm sure they do have those programs in place, but it says so much that wasn't the first thing that popped into their head. And it reminded me of our previous interview with Dr. Faisal Syed, when the semantics of changing walk-in patient to patient in need. And it's almost like MUSC has figured that whole thing out too. They've been able to shift that lens from whatever these other things are, these burdensome, like, no, it means more paperwork. No, it means this, to yes, how do we make this happen? And I love that. I love that that's also the community of leaders that we're featuring on this show, because that's what really will make healthcare work.
Beautiful. What needs to be done and getting it done. That's great. That's how you make healthcare work. So I love that thought process, Stephanie.
And thank you all for watching, and make sure you watch the full interview with Dr. Katherine Twombley. It is fabulous. We'll talk to you soon. Bye-bye.